Today we're going to be walking through how to use the Strengthening Families Self-Assessments for child and family serving programs. My name is Kaylin O'Connor from the Center for the Study of Social Policy, and we'll walk through what this tool is and how you can use it, including how you can use it in the online Strengthening Families evaluation portal. So just a little bit about the background of the self-assessment. It's really a key implementation tool for any type of program that's adopting a Strengthening Families approach, and that could be a program in the early care and education field. It could be another child and family serving program. We have several versions of the self-assessment, as I'll mention later. But what it helps programs do is to identify the small but significant changes that they could make that would enhance their ability to help families build protective factors through their contact with the program. The original self-assessment was designed based on an extensive national study where we went and visited the early childhood care and education programs that had been nominated and vetted as programs that were doing a great job at not only caring for children but supporting their families and building protective factors as they did so. Based on what those programs were already doing, this self-assessment was created, listing off the very concrete strategies that they were using that other programs could also replicate. It's really not designed to be a list of things that programs should do everything of. There's no program that would be doing every single thing on the self-assessment. It's really designed to be used flexibly to give you ideas and to help you develop an action plan of with new ideas you'd like to do or things you'd like to strengthen. It also helps you to identify the areas where you're already doing really well. And we always like to emphasize that it's not an evaluation tool. It's really designed for continuous quality improvement. It's a self-assessment, self-reflection tool, and it hasn't been validated for use in evaluation, but we do recommend that people use it, that programs use it as they consider where they want to make improvements in their quality, and checking back in on it at a later date, even though it's not designed for a pre-post use. It could be a way to look back at what changes you've made and what else you'd like to keep working on. So as I mentioned, we actually have 4 different versions of the self-assessment. These were released in 2014 as an update to the previous version of the self-assessment that was designed for any type of program to use. We decided that we wanted to get more specific about what programs could do in different contexts and given a different relationship with families. So there are 2 versions that are for early care and education, one for center-based programs and one for family child care programs. Then there's a Strengthening Families tool for home visiting programs, and there's another for community-based programs, by which we mean family resource centers, family support programs, really any other type of setting that serves children and families in a community-based setting. Each of these self-assessments has a very similar organization. They're organized around the protective factors and a group of what we call everyday actions that help families to build those. We also have, in addition to the protective factor sections, some special circumstances sections. So in those protective factor sections, you see in this graphic, as you read across that middle row, you can see the 5 protective factors. For each of those, there's a set of everyday actions that we know help to build that protective factor. And within each of those everyday actions in the self-assessment, there are a number of very concrete, specific things that a program could be doing. Some of those will be program policies, some of them will be staff actions, some of them will be more about the culture within the program. They vary, but they're all very specific, and there are a lot of options within each of these everyday actions of ways that your program might be carrying that out. Now, in addition, there's a section about responding to possible child abuse or neglect, which is included in all 4 self-assessments. And then there's a section about supporting a child's transition to school or other programs, which is included in both of the early care and education versions. And of course, that's really about supporting both the child and the family as they transition into kindergarten or move between early care and education programs. Now, the early care and education self-assessments are specially designed to support their use in quality rating and improvement systems. We know that many states and jurisdictions have started using the Strengthening Family Self-Assessment as a way for programs to demonstrate what they're doing in terms of parent and family engagement. So when we redesigned the tools in 2014, we wanted to be sure to facilitate them being used in that way. So those self-assessments have items that are listed at different levels. We don't call these quality levels. We call them about how much, we refer to them in terms of how much attention is being paid and how many resources are being put into parent engagement and support. So in each of these, you'll see that there's a baseline, and these are things that we really believe any program could be doing to better engage with parents. Then there's the mid-level, which are items that reflect more attention to parent engagement. And then the high level, which is about having a high level of attention and probably some investment in parent engagement and support. In the case of family child care, we just have those 3 levels, and the high level we recognize will most likely happen in programs that are part of a system that provides them some support, which we highly recommend family child care providers get engaged in. But we recognize that an individual providing family child care without being part of a larger network may not be able to do those high-level items. In the center-based assessment, we have 4 levels, where the 4th one is for comprehensive service programs. So really Head Start or preschool that's attached to a family support center, where there are multiple services available and a comprehensive range of supports. And again, that's not something we think the typical center-based early care and education program will be able to provide, but it's something to strive for and something to take note of as a non-comprehensive program. There may be some pieces there that you could do at that higher level. So let's see what that, we'll see what that actually looks like in a moment. I did want to comment about the tool's length. The self-assessments are very long. Some of that is just a question of the formatting. We wanted to leave enough white space that you can actually read it and take it all in and go through and fill it out and write notes. But it's also just because there are a number of items there for every everyday action. And as I mentioned, we're not suggesting that any program should be doing all of these items. The idea is to promote reflection and continuous improvement. So you might go through one time and find in one section there are 10 items and you think you're doing well on 4 of them. And you might be able to pick out 1 or 2 that you want to do more on. And the next time you go through, you will have improved in that. So the formatting does add to the length, especially the tiered versions, which I'm going to show you in a moment. And we encourage you, especially given the length of the tools, to use it in whatever way makes sense for your program. You might want to complete it one section at a time. Take a section, complete it over the course of a month, and then the next month take another section, or even 6 months later take another section, depending on what works for your organization. For early care and education programs who are using the tiered version, you might look at all the tier 1 level items first. And once you feel confident that you're doing as much as you can within those items, then move up to the 2nd level and start looking at which of those items you're doing or could be doing. So we have recommendations about how to use it, but we think it's, as long as it's part of an ongoing active and reflective improvement process, it's going to be a benefit to your program. So for completing the self-assessment, we strongly encourage you to use a team to complete it. We're looking for a team that would include someone from the administrative level, someone who's a direct service provider, and a parent or a service recipient. And the reason we do that is that we've often found those three participants in the self-assessment process will have a very different perspective in some ways on what's going on in the program. And so having the parent there, having the administrator there, and the teacher can help you to identify places where maybe the program has some resources but parents aren't aware of them, or has policies in place but the teachers aren't implementing them consistently. Things like that you won't find out if just the administrator sits and goes through the self-assessment. The process that we recommend most often is that you fill out the self-assessment individually, which might take about an hour and a half, and then you convene as a group to sit and go through it and share and compare your responses. And I think there are, depending on your group process, you will probably find that you have your most conversation on items where there are different responses. There might be some that you all agree we're not doing this, some that you all agree we're doing this really well. The ones where there's some difference in opinion is the one where you can really have some conversation and talk about, for those who don't see that happening, how could that be changed? And then we encourage you to fill out a group consensus self-assessment, which is the version that you would probably put into the online system that we're going to go into in a little while. Another way you can do it if you don't have the time for individuals to complete it on their own before you meet is to come together as a group and go through it together fresh. So you haven't all already responded and you just go through and talk about each item as you go. I think it takes a little bit longer that way, and you need to be careful about the power dynamics in the room, whether the parent or even the teacher is going to feel comfortable speaking up and disagreeing with something the administrator has said. But I think if you set the table well for that to happen, it can still be a very productive process, and it can take a little less time that way. I see a question here from one of our participants about how large the team should be. I think as long as you have those 3 levels represented, you could just do a team of 3 people. Of course, if there are more people who are interested and want to be involved in it, I wouldn't stop anyone from participating. I think you might not want to go much over 5 or 6 people in a group to be sure that when you go through it as a group, you really get group consensus and have everyone having a chance for their voice to be heard. But certainly if more people wanted to be involved, I would encourage that. Or if you have, maybe you'd want a teacher from the infant room and a teacher from the toddler room, something like that, or even a parent from each of those rooms because their experiences might be different. So thinking about which perspectives you need and trying not to have duplicate too much. But I think the more you can do it as a group process, the better. Okay, so this is what a page of the self-assessment actually looks like in its PDF version. So this is the version that you can download from our website and print. And again, it is long, but it is freely available for you to download and use. And this is one of the tiered items from the center-based early care and education. So you'll see we're in the protective factor of parental resilience, and the everyday action is about programs demonstrating that parents are valued. So a specific item within that is that the program has multiple avenues for regular communication with families. And then you'll see Tier 1, Tier 2, and Tier 3 specific things that programs might be doing. Now, in this case, for Tier 1, there were no sub-items. For Tier 2 and 3, there are some. For each item, you mark whether you strongly agree, neither agree nor disagree, strongly disagree, or put not applicable, which can also generate a lot of conversation about why something wouldn't apply to a given program, but it, of course, can be the case for some of these items. There's also room for comments, which I think is very helpful if you complete this individually and then go through as a group. It can be helpful to put a comment such as, this is an area I think we could do a lot better, or we've improved a lot in this over the last year, those kind of comments. Now, once you've completed the self-assessment, you can develop an action plan. And I will say this is very easy to do using the online tool, and Tori is going to demonstrate that in a few minutes. But the idea, which you can also do with a paper copy of the self-assessment, is to identify some of your areas of strength and create a sustainability plan for keeping those areas strong, and then to identify practice areas that were rated poorly, either by the majority of your participants, of your team, or in a consensus version, and decide whether, or pick things that should be addressed, whether they should be addressed immediately, over time, or not at all, and brainstorm some plans for improvement. And we'll see in the Strengthening Families evaluation portal where you can designate specific items for following up and put them on a timeline, and then you can check back in and fill out as they get completed. And I think that can be a really useful process just for making something very concrete and for narrowing down from the big self-assessment process that could give you hundreds of different ideas, especially across the team, but then to settle in on 3 to 5 items that you're going to focus on in the next 6-month period or something like that can be very useful. And I see a question here about if you completed the self-assessment in sections one at a time, how would you complete the action plan? I think depending on how much you were spacing out the sections, you might want to do an action plan after you've completed a section, and it might just be 1 or 2 items from that section. That would assume, though, that you're not going right on to the next section, but that you'd rather finish the section, have some time to digest it and work on an action plan and start implementing the action plan before you get into the next section. So if you're really spacing it out, I would do it that way. If you're kind of doing them sequentially and we're going to meet again in 3 weeks to do the next section, you might want to wait and do an action plan, or maybe sketch out an action plan as you finish each section and then bring them all together to select some top priority items at the end. We're not trying to overload anyone here with having 17 different program improvement steps on your action plan, but rather to help you find a couple key areas you want to focus in on. And when I say small but significant changes, some of the things in the self-assessment really are quite small, and they wouldn't require resources or very much time to implement. So some of them you might be able to say, I've done trainings where a child care provider comes out and says, well, as of tomorrow, I'm going to really start learning the parents' names. Sometimes just taking the lazy route and say, hey, Jane's mom, can you do this? But I'm going to start learning all their names. And that's not something that needs to be on an action plan. It can be to make sure that you keep yourself accountable to it, but it might also just be something that you internally decide to do. So I'm veering off a little bit from the formal action plan, but just to say that you want to keep your action plan reasonable, even though there may be some other ideas that individuals kind of start implementing on their own. All right, so I wanted to take a moment before we start looking at the evaluation portal to talk about tools to measure protective factors, because often when a program has engaged in the self-assessment process, they then want to get input from parents about how strong they are in their protective factors, or they want a way to measure whether the changes that they're going to make as a program are going to affect how parents report on their own sense of their protective factors. So we actually have 2 tools that have been developed related to the Strengthening Families Initiative, specifically to measure protective factors. The first one developed is called the Protective Factor Survey. This is being widely used across the country. It's been out for several years. It's reliability and validity tested. It's 20 items so that caregivers complete it and report on their own protective factors. It's really not designed for individual assessment. It hasn't been benchmarked for, a certain level requires a certain intervention, but it's more just to show change over time. And I would really recommend that you use it in the aggregate. So you look at a group of parents' responses at one point and the group of parents' responses at a later point in time to see where your changes have been, more so than in individuals. This was developed with, in a partnership with Friends, the National Resource Center for Community-Based Child Abuse Prevention, and the University of Kansas. It was an intense process with a lot of input from around the field, many test versions of it used to get the reliability and validity needed to have it be an accepted tool, and many people have used it with great effect. That Protective Factor Survey, the PFS, is available in the Strengthening Families Evaluation Portal, which you will see in a moment. The other tool that's available now is the Parents' Assessment of Protective Factors, or the PAPF. This one was developed by the Center for the Study of Social Policy as part of our Quality Improvement Center on Early Childhood. It was released in 2014, around the same time as the updated self-assessments. It provides another tool that you can use. It has 36 items on it. Once again, the parent indicates the degree to which they agree with or how much the statement is like them or what they believe for each of these 36 statements that are related to 4 of the protective factors in strengthening families. You can access that tool on our website at strengtheningfamilies.net. There's the tool and a user guide. Both are available in English and in Spanish. And soon that tool will also be available on the Strengthening Families Evaluation Portal, but it's not quite there yet. So with that, I'm going to hand over to Tori Monick from Mosaic, our national partner who provides the Strengthening Families Evaluation Portal. And I'm just going to give her the screen.
Sounds good. Okay, hello everyone. Okay, so this is the Strengthening Families Evaluation Portal from Mosaic Network, and I'm going to walk you through what it's like to register as a program provider, and then walking through the completion of the surveys, creating an action plan, and how to access and interact with the protective factors surveys for staff and parents, and just generally give you an overview of the system. So as a new user, I'm going to click here where it says Programs, click here to register for free. And the system's reacting. Okay. So then you would just come in and enter all this information, the program name and address, your name, your email address. In this process, you actually create a user ID and a password. So once you click submit here, your account is created instantly and you don't need to wait for an email link to confirm it or anything like that. When you are creating a user ID, you should not use special characters. It only accepts certain special characters. So we recommend creating a user ID that is only alphanumeric. The password, however, must have at least one number. And I'm just going to go ahead and log back in as a test user. And I clicked on the login as a registered user. And you can see now I'm in the program details section of the website. And this is where I'll complete the registration for all the details of the program. Some of these fields have been carried over from when I created the account. Of note here is the program type. As Kaylin mentioned, there are 4 different surveys depending on the type of program that you are operating, and you can click any and all that apply. What this does, it will give you access to all applicable surveys. So I'll show you that in a moment. This is asking about various demographic information. Some of these questions are in the form of percentages. So the percentage of children enrolled in each age group, for instance. And if I want to save here, I can. I think most of the time in this system, if you try to just move away without saving, it warns you. It's pretty good about giving you that warning. So I'm going to move into the program self-assessments, and as you can see, I had all 4 checked, so I can actually tab through each of these assessments and interact with them in the system if more than one of these particular surveys applies to me. You can click on the orange link to pull up the entire survey, or you can click on a particular section or a particular indicator. So you can kind of interact with it as macro or micro as you're hoping to. As you can see, here are the tiered items for you to complete. Tier 1, staff strive to recognize and affirm the central role of parents in their children. You can choose whether you agree, strongly disagree, etc. And then I've checked this box here because I want to include this in my action plan. As you're completing the survey, when you check this box, that's the point where this gets added to your action plan. And you can go into the action plan and create detailed information, but unless you check this box, it won't actually show up in your action plan. So this is the time when you're thinking about it and you think, yeah, we do that pretty well, so I don't need to include this in my action plan. But for some, you may decide we really need to improve on this. We don't do this as well as we'd like to, so I'm going to include that in my action plan. I'm going to click Save here and close the box. And again, it's reminding me to make sure that I've saved my work. Moving on to the action plan. The wheel is spinning, something's happening. As you can see here, I'm in the action plan. Everything that I've checked off to include in my action plan shows up here. What I can do is go in and view or edit each item. I'm going to go ahead and add an action step. So I've included this, but I haven't actually added information about how I want to take action on this. So here I can add a title. My expected results will be an improvement in this indicator. Although you'd probably want to use good spelling. You can add required resources, but that's not a required field here. So you can say books or TA, something like that. You can add a person responsible. Again, that's not a required field. The yellow fields are the required. The date for achieving, so when you'd like to accomplish this. You can add check-in points for monitoring implementation and progress, add how and when longer-term action steps will be addressed or implemented. You can assign a priority, and you can also go back in at any point when this is completed and check it off. And then these will show up in your action plans. Another thing I'm going to walk you through is the protective factors surveys for parents and staff. I don't have any accounts here, so what I'm going to do is add a record. Now there are two ways that you can interact with these surveys. You can either create an account here where you add the parent or staff member's email address. You can select whether it's a parent or a staff member. You can add their email address here, and what will happen is it will email them the survey in email form, a unique user ID. They can complete the survey, and then those results will be shown up here in the system. If you are logged in as a state administrator, you can view all of these results through the system. If you're just logged in as a program provider, which many of you will be, then what I would recommend is actually downloading the survey from our system. You can download each of these surveys, email out the PDF or distribute the PDF in hard copy, have your staff or parents complete the survey, and then go back into the system, and when you create the account, you actually send it to yourself. So you would put in your own provider email address here, and then you would complete their information from the hard copy survey. And then all the data would be stored within the system. As I mentioned, you can download any of the surveys here. We also have a reminders section so that if you have created a pre-test or a post-test, one thing in the parent and staff account is you can decide when you would like a pre-test to be completed and how much time needs to go by before you'd like to do a post-test. And so this section will show you reminders of when those are coming up. And finally, if you ever need assistance with the system, you can click on the Need Help section, and you can contact Mosaic by phone or email, or just fill out this form and submit a message to Mosaic, and we can help you with any online technical assistance with the system. Now that was pretty quick in terms of an overview. Would anyone like to drill back into any particular area?
So Tori, there were a couple questions.
Sure.
And
I'm sorry, I'm not very good at this webinar thing.
Oh, no, you're doing great.
Okay.
So one question was about just going through again how to get into the system. So if you could show that opening screen and how you get there.
Right, great. So this is the URL here, strengtheningfamiliesevaluation.com. If you're a brand new program user, you'll click the big green button, Programs. Click to register for free. If you've already created your login, then you'll register here. You'll log in as a registered user here. So I'll show you this process again. This is where you're entering your program details to register as a provider. And you'll be entering your program's name and address and your own personal name, email, address, phone number. You'll create your user ID here and your password, so you'll want to jot these down. And again, we recommend alphanumeric for these. And once you've done that, you can just register as, go in as a registered user. Click right here. What I'll do is log out so you actually see the login process. So what you would do when you see this button, registered user login, is you'll see this screen pop up and you'll type in your username and your password and log in. You'll see these instructions, or you can click this box if you don't want to see this again. It's just basically a welcome message. Click OK, and there you are logged in to the system, and there are your details.
All right. So thank you very much for doing that. And we actually had a couple of questions about how this relates to the previous system, the GEMS Live system from Mosaic, and people asking about whether they can get their data that was in the old system or whether their user ID will still work in the new system.
They are completely separate systems. Some of the things that changed are, obviously, we've added the newest surveys from the CSSP, which includes the 4 different surveys rather than just the one. We've included the tiering, and the action plan module is a new module. We've improved the user interface, and those are the major changes to the system, but it was developed as a completely separate system, so you would need to register again in this system. With regards to getting any old data out, I'm going to have to follow up on that. I know we did we kept it alive for about 6 months after, 6 to 8 months after we launched this system, and we did try to do some outreach about whether anybody needed to get information out of that system. But if there are specific people who are interested in trying to get data back out of that, I can certainly look into it.
Okay, thank you. And I think there was another question that I can actually answer that was about the database that you can download to your own computer from the Friends National Resource Center for the Protective Factor Survey only. That's still there. That's actually not an online data system. It's an access database that they set up that you can download to your own computer and enter your Protective Factor Survey data into it. So if you've been using that, you can continue using that. That's still available from Friends. They always welcome if you send your data into them, but it doesn't automatically go into any kind of centralized system when you use the database on your own computer. And it doesn't then connect with the self-assessment as it does when you do it through this system. I see another question. And again, this is one I can probably answer. The question is about whether the contents of the self-assessment and the other tools will be available in Spanish on the Strengthening Families Evaluation portal. At this time, I don't think they will be. Tori can correct me if I'm wrong, but we have been we try to get materials translated as we can, but we don't have a lot of resources for that since we make these all available for free. So we do have a Spanish version of the Parents' Assessment of Protective Factors. There's also a Spanish version of the Protective Factors Survey, but I'm not sure whether Mosaic would be able to accommodate using the Spanish version in addition to the English version. And as far as the self-assessments themselves go, we are hopeful that some of our partner states, including possibly New Jersey, will be translating some of the materials, and if that happens, we hope to be able to share those with others, but that's a little bit down the road, and we haven't talked with Mosaic about whether Spanish versions would go into the evaluation portal as well.
Yeah, we would love to be able to accommodate that at some point in the future.
Okay, so I think I'm going to take back the screen. Thank you very, whoops. Okay, I did that wrong. Excuse me. I got to get back in here. I want to make myself the presenter. Okay. Okay, great. I pressed the wrong button there. So I wanted to just quickly say that when you're using the self-assessment, our hope is that you use that to document progress over time. Using the evaluation portal certainly helps with that process, although you can do it in a manual hard copy way as well. Whichever way you do it, we hope that your results will be part of that active, continuous quality improvement process. And I also think it's important to note the evaluation portal, again, helps facilitate the process, although it could also be done in other ways. But it's great when local and state decision makers can see the data coming from programs, look at it at an aggregate level for a community or a state, and see where programs are doing really well and where they have needs that might be met by training or other resources to help them make some changes. So we really encourage states to think about that at an administrative level, about how they might be able to provide better support by understanding where the strengths and needs are among the programs that are using the self-assessment. And as Tori mentioned, there is an administrative access to the Strengthening Families Evaluation Portal that states can seek out if they want to do that. I have some web addresses here for if you're looking for more information. And the other thing that I want to do is just show on our website, actually. Oops, I'm going to try to go to the website. So if you type in strengtheningfamilies.net, you come to a part of the CSSP website. And just want to make sure that you see the tools we've been talking about are all located under the practice section. The program self-assessments are the very first thing there. So you can just download these PDFs of the self-assessments and some materials about them. But also under ensuring accountability is where we put all the information about the parents' assessment of protective factors, as well as the protective factors survey and the research behind strengthening families and the evaluation portal. So there are lots of resources there. Just wanted to make sure you knew how to find them. And getting back to these addresses, I believe, let me check for final questions. One of our New Jersey partners saying if we get the document translated, we will share it with others nationwide. We very much appreciate that. Thank you. Okay, I'm going to stop the recording, and thank you all for participating.